Today I want to talk about a variation in a thoracic extension drill, and we call it a bench T-spine mobilization. And I'm here with Nicole, and we're going to go through the first variation where we're going to really focus on the T-spine, but then we're going to show you a variation that focuses on working the rib cage around the thoracic spine, because at the back of your thoracic spine, those ribs connect to each facet joint of the vertebrae, and when they're moving, even if it's a slight movement or variability, it's going to change where your spine is going to stack. So we're going to show you a different variation that you can utilize to help improve extension by kind of putting the vertebrae stacked in a better position. So I'm going to have Nicole get into the traditional bench T-spine position. What she's going to do here is she's going to have her elbows about right in line with the shoulder, maybe a little bit off. She's holding this dowel or stick to help create a little bit of stability or a place to connection point so she doesn't internally rotate her hands when she goes through. So as she's eventually going to do this, she's going to kind of pull the stick apart as if in the middle. She's playing a little tug of war there just to create a little bit of stability for this shoulder component, so then we can focus on the thoracic spine. So, and then she's kind of back with her knees under her hips. From this position, what she's going to do, she's going to breathe in through her nose, create a good inhalation, and then when she exhales, she's going to kind of sink back into it and relax. And this is that first variation we talked about, that bench thoracic, to create a little bit more thoracic position of the spine. Okay, so now what we're going to target in this is we're going to focus on the rib cage and not her sinking as much to create more of that extension position. So she's going to come up, reset, she's going to breathe in, she's going to exhale, sink a little bit, she's going to pause there, and then she's going to exhale and tuck her rib cage just a tad. Okay, and you're going to see there is a little bit of rounding here, so you're like, well, we're looking for extension. Yes, but we also have to consider that the ribs, when they internally rotate, like I said, they're going to shift the spine into a better position, and that's why when your ribs internally rotate and then when they externally rotate, when you inhale, walk, whatever you do, there is a little bit of manipulation here at the thoracic spine. She can relax for a second. So when we're targeting this spine right here, yes, we want to go into the first drill, take a breath in, and then exhale and sink and work more of that thoracic extension if we're talking here. However, we have to take in consideration the connection points of the rib cage to those joints. So then when we throw in the second variation, she's going to breathe in, and she's going to exhale, sink a little bit, and then she's going to focus more of tucking the rib cage, so tucking it down and back. That's going to help finish and finalize stacking this in these vertebrae joints into a better position for a thoracic targeting mobility drill. Thanks, Nicole. So when we're thinking about improving thoracic extension or doing anything to improve T-spine rotation, extension, or flexion, we need to take in consideration what the rib cage is doing as well. Because as you breathe in, ribs are going to externally rotate, extend out, and allow you to get this oxygen into the lungs. And then when you exhale, you're going to have them, they're going to internally rotate and kind of pull back to get all that carbon dioxide out. And that's going to influence that thoracic spine. So anytime you're doing some thoracic mobility drill, take into consideration where your ribs are placed, because they do have component when you're trying to improve mobility or even improve stability.